let's talk about how we talk about healthcare, because we are not great at this, even though it matters a lot. And that's the topic of this week's Healthcare Triage. When we talk about healthcare, we tend to reduce a very complicated system into very simple narratives. Costs are high for one specific reason. Outcomes are bad for this other specific reason. Fix one thing and everything will improve. Those kinds of statements feel good. They're clear, they're actionable. They are what make you feel like you understand what's going on. Unfortunately, they're also incomplete. We've hammered on this over and over in this series, and it's worth hammering again. The U.S. healthcare system is a mix of high prices, administrative complexity, uneven access, chronic disease, and underinvestment in things like prevention and social supports. It's not one problem, but we're always talking about it like it is. You'll hear arguments targeting insurers, hospitals, drug companies, and so on. But when conversations zero in on a single villain, they can oversimplify what's actually happening. Another common issue is how we talk about spending versus outcomes. People often assume that higher spending translates to better health outcomes. Intuitively, that makes sense. But in reality, the US shows that being the biggest spender doesn't lead to better outcomes, especially if that spending is inefficient or not directed towards the most effective interventions. It's not just about how we spend, it's about how and where that money is used. We don't communicate about timeframes very well either. Some interventions, like improving access or expanding coverage, can have relatively immediate effects. Others, like investing in prevention or addressing social determinants of health, can take years or decades to show results. But public and political conversations often operate on short timelines, so long-term strategies can get undervalued or dismissed because they don't produce instant visible wins. Then there's the way we communicate nuance or uncertainty. Healthcare is complicated. Evidence evolves, policies have trade-offs, but communication often presents things as more certain or more absolute than that, which can lead to disappointment when solutions don't work exactly as expected. Even worse, that kind of communication erodes trust, and that sucks because healthcare depends on trust. Trust between patients and providers, trust between the public and institutions, and trust between policymakers and the people affected by their decisions. When people don't understand how the system works or feel like it's working against them, it becomes harder to engage with care, follow recommendations, or support policy changes. So what would better communication look like? First, it would embrace complexity instead of hiding it. It would acknowledge that multiple factors are at play. Second, it would be honest about trade-offs. There are very few solutions in healthcare that don't involve some kind of compromise. Being upfront about that builds trust, even if the answers aren't perfect. Third, it would connect policy to real experiences. At the end of the day, this isn't just about systems and spending. It's about whether people can see a doctor, afford their medications, manage chronic conditions, and live healthier lives. And finally, it would avoid the temptation to turn every discussion into a political identity test. Healthcare affects everyone. Policy debates are inevitable, but reducing complex issues to partisan talking points doesn't make the system easier to understand or improve. It just shifts the conversation from how do we fix this to which side are you on? It's a real problem that the US spends a lot on healthcare and still has a lot of sick people. How we talk about that problem shapes how we understand it and what we're willing to do about it. If we want better solutions, we need better conversations. AcademyHealth is all about making research matter, turning evidence into real-world impact on health and healthcare. That's exactly what Healthcare Triage is about too, breaking down the complex, sometimes messy health policy and research stories that affect all of us. Basically, we're tired of the nonsense, and that's why we've teamed up to bring you this important series so we can fight the nonsense together. We'd really appreciate it if you'd like the video, subscribe to the channel down below, go on over to patreon.com/healthcaretriage where you can help support the show, make it bigger and better. We'd especially like to thank our research associates, Edward Liljeholm and Christopher Learn, and of course, our Surgeon Admiral, Sam.